Thank you for joining us for this evening's webinar, Master Non-Surgical Techniques, live with Dr. Renato Saltz and Dr. Jason Bloom. Dr. Saltz is a board-certified plastic reconstructive surgeon, and he takes a special interest in facial rejuvenation, body contouring, breast surgery, and reconstruction after cancer. He has taught and practiced plastic surgery since 1989, and he has offices in Park City and Salt Lake City, Utah. And Dr. Bloom is here with us tonight. He's an award-winning, Ivy League trained, double board certified facial plastic and reconstructive surgeon. He had the first installation, he says, in the US back in 2020. His philosophy is to tailor a treatment for each patient's needs. And he's really into the natural look with the least possible downtime. And we're really into that as well. So thank you for being here, doctors. And Dr. Bloom, let's get started with you.
Great. Well, thanks for having me, and thanks for everyone who showed up for the webinar. And Carolyn's right. I was the first, clinical installation of a Sofwave device in the United States, and it was 4 years ago, February 2020. The meeting actually just passed this past weekend, but it used to be called the Miami Cosmetic Surgery Meeting. And I was down there February 2020 and talked to the people who, a team that I already trusted, Lou Scafuri and John Nippler, and really they explained the technology to me, and I got treated, and I was sold. I actually bought it sight unseen. And then the next month, kind of COVID hit and the world shut down.
Right.
But one of the cool things about it, and that we'll talk about, is I really was able to, train my whole team, get trained on the device, like over the internet. I mean, this is so, your team gets up to speed on using the device extremely easy. We're going to talk about how safe this device is, how easy it is to learn, how easy it is to treat patients. And again, I've had it since February 2020. I've never had a problem with it. It's been absolutely a standout in my practice. So not many devices actually have the ability to, to claim that they have 7 different FDA clearances. And the interesting thing is that in order to obtain an FDA clearance, you need to do a clinical trial. And so each of these individual claims and clearances was the result of a clinical trial that was performed. And the nice thing is this same device is able to treat both indications on the face as well as on the body. So the first was the improvement of facial lines and wrinkles. Next came the improvement of, the brow, to enable the ability to lift the brow, which non-surgically, I think this is, in my mind, one of the best treatments other than using neurotoxin. This is a long-lasting treatment. You can lift lax skin of the neck, treatment and lifting of submental area underneath the chin, improvement in the short-term reduction of cellulite, acne scarring, and then most recently, they got an improvement in the appearance of arm laxity. And then Renato is going to talk a little bit later on kind of the latest offering from Sofwave, which he'll discuss towards the end. So what makes this synchronized parallel ultrasound beam technology, this superb technology, as they call it, what makes this mechanism of action unique? Well, the first thing is it's controlled fractional thermal injury. So we know that it's not you're creating small little thermal injury in the dermis. You were bypassing the epidermis, so there's no downtime because totally the epidermis remains intact throughout. And we know that we're just treating at about 1.5 millimeter depth. So you are targeting the dermis the entire way. And you can see from this histologic slide here, just underneath, that these are micro injuries to the dermis. And not just that, but the treatment involves 2 important things. So first of all, the thermal energy. You need to get to at least 60 to 70 degrees Celsius in order to create a thermal injury enough to have the body repair itself. And there needs to be time. So these injuries are occurring at about 4 to 5 seconds of exposure. And the amount of tissue coverage is really leading in the industry. So whether you're using like a fractionated RF microneedle or HIFU, whatever it is that's creating these dermal injuries, what's happening with the Sofwave and the superb technology is it's creating an injury. Each pass is 7, the transducer has 7 individual columns that it lays down, and each are basically 1.5 by 4 millimeters at a depth of 1.5 millimeters below the skin surface into the dermis. And that is, if you do a standard 2-pass treatment, you're getting somewhere between at around 25 to 28% of the tissue. If you actually do a 3rd pass, you're getting almost like 40% of the tissue coverage. That's a huge amount of damage to the skin that allows for the contraction of the tissue as it heals itself. Another kind of interesting thing is the directionality of this, tissue damage below the skin surface. So when you're using a laser or HIFU or RF microneedle, those are all perpendicular to the surface of the skin. The unique thing about this mode of action is it's creating an injury that is in line with basically in parallel to the surface of the skin, which allows for better tissue contraction. And as we know, is when the body heals itself, new collagen, elastin, HA are all produced. And as I said earlier, the patient safety with this device is, I would say this is the safest, really the safest energy-based device that exists in my practice. Other than if you fire this over an open eyeball, it's very, 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 very difficult to create an injury with this. So there are 2 different applicators that you can use. So this was the original offering, which was the lift applicator. As you can see, there's 7 different, injuries that are created with this single transducer head to create a large amount of tissue injury that you need in order to create the damage. And each of these areas is about 4 millimeters in width and about 1.5 millimeters wide. So you're getting that times 7, whereas some devices just have one kind of pinpoint, 1 millimeter by 1 millimeter. This is each of the bands that's laid down is a column of energy that creates this kind of like a cylinder of a thermal injury. And it has soft cool, which is kind of this thermal cooled aspect to the handpiece, which is kind of skin contact cooling in order to cool the dermis, even though to cool the epidermis, even though the energy is passed through the epidermis. This is just an additional patient safety mechanism in order to cool it so that the energy is placed below it. And then a couple years ago, the Precise applicator came out, very similar to the Lift applicator. I actually have this in my practice as well. But the Precise applicator has just 3 of these high-intensity, high-frequency ultrasound beams. So it's good for small, tight areas. Because it's a little bit smaller, it's great for the upper lip, great for kind of lateral brow, infraorbital area. Anything outside the orbital rim, I like to use it. Upper lip, small, different, difficult to treat areas. And the nice thing is when you buy like pulses to actually run and power the device, it doesn't matter which applicator head you have on there. They're all good for this device. And I remember, we had different devices where there was cards with it, and or the hand pieces, and you would find like an expired hand piece in your drawer, and you're like, oh my God, I just spent all this money for this hand piece, and now it's expired. It doesn't work anymore. The nice thing is this is pulse driven. You can kind of pay as you go and customize the treatment based on what you want to do. If you wanted to treat the neck, if you want to treat the submental area, maybe the patient is there, hey, yeah, treat my brow at the same time. You can totally customize it during the treatment. And as we know, how this works is basically creating a fractionated tissue injury and the wound healing response of the body. So you can see here, it bypasses the epidermis, it lays a fractionated column of tissue injury into the dermis, and then it stimulates the wound healing response of the body. So new elastin, collagen, and it's that thermal injury at 60 to 7 degrees Celsius at a depth of about 1.5 millimeters that, keeps it significantly into the dermis. You're not going below the level of the dermis to create kind of like fat loss. We're not going into the SMAS. We're not going into the fat. So there's no kind of fat atrophy with a device like this. And importantly, the epidermis is spared. So there's no epidermal damage or downtime. And again, this is just kind of showing how the energy is laid down. The red is this kind of 4 millimeter band of tissue damage times 7, and 2 passes with this covers 23 to 28% of the tissue. That is really the largest tissue coverage in the area in the industry. And I'm always asked by colleagues, like, how do you get good results? And, we used to, and I would say it's less about the energy, because we used to crank this thing up and really we thought it was like the energy that you put in. We used to crank it up and do like one pass. And what we found is that at a reasonable energy, somewhere between 3.5 to 4.0, and multiple passes, the more you stack energy and small fractionated injury to the skin, the more tissue coverage you have and the better result. So the more passes is more important than the higher the energy. So I would rather go to like a medium energy and with multiple passes rather than fewer passes with a higher energy. Okay, so we're just going to look at some of the before and afters. This is a Ann Chappas. This is a patient of hers. You can see kind of they did lower face and maybe mid face here, improvement in the cheek, mid face, along with the jowling. This is a patient of mine. This is she works at my front desk. I treated her brow. This was one treatment. 14 weeks after, we treated above her brow on each side. We were talking a little bit about how most of my patients do well with Zimmer chiller. Occasionally we do numbing cream. The one thing is when we treat the brow, and my estheticians in my office do every one of these treatments. When we're treating the brow, I do a small supraorbital, either my nurse or I will do a small supraorbital supratrochlear nerve block on either side. It takes me less than a minute, and we're able to thoroughly treat the brow. And she got a significant improvement in her brows. This is no neuromodulator. This is not surgery. This is just one single treatment of Sofwave. Here's another, Michael Gold treatment. This is from one of the clinical trials. A nice improvement in the submental area here. Again, this is 2 treatments. Nice softening in the kind of platysma and submental area. Suzanne Kilmer. No, we don't do any real body treatments in my office, but you're using the same device. You don't need to buy a new head. You don't need to buy a new box. You can use the same device that you treat the face with to do these body treatments. And you can see improvement in the appearance of cellulite here. As we all know, cellulite is extremely hard to treat. This is Guillermo Munavali's treatment. Again, here, this is from the clinical trial. You can see kind of the look at the rippling. This is more kind of like not dimple cellulite. This is more kind of like rippling and undulation of the tissue before and after. And you can see how rippled it was before to improvement. Again, there's nothing, they're not kind of adding anything to it. This is just using the Sofwave to improve the appearance of cellulite. Acne scarring, and I think this is actually really this is really interesting and telling. Here's a patient 4 months after treatment, David Goldberg, and here's another treatment, Ariel Kavar. Again, these are significant improvements in their acne scarring. And the interesting thing about this is both of these patients are, I think type 5 skin. 4 to 5 skin, which is, a lot of the treatments that we have for acne scarring is, you're talking like ablative laser or, involves significant downtime and are very difficult to treat, your high Fitzpatrick skin types because of risk of post-inflammatory hyperpigmentation or scarring. And these are nice improvements with acne scarring in high Fitzpatrick patients, which is, I think, a huge improvement in some of the options that we have for acne scarring in these patients. And then lastly, the most recent offering that they're doing is for upper arm laxity. And you can see just improvement in the crepiness of the upper arms here. Again, we haven't done any of these treatments in my office, but this was from the clinical trial in Roy Geronimus. And I think that's a nice improvement, 1 treatment at 4 months. So just kind of in summary here, you can see that there were significant FDA trials and energy that have been put into this device in order to get each of these indications approved, starting in 2018 and 19, even before it was clinically available, the device. The first trial came out, and that was, when I purchased it. Then shortly after I purchased the device in 2020 to 21, it got its brow lift, submental lifting, and neck lifting indication, followed by cellulite in 2021 to 2022. The improvement in acne scarring was towards the end of last year, 2022 to 23. And then most recently, again, at the end of last year, was the improvement in arm laxity. So these are each individually studied. They have gone through, they were clinical trials that were done and approved for the FDA with these pivotal studies, as you can see, 7 different indications. So with that, Sofwave in my practice has been extremely consistent. It's color blind, as I say, so there's all skin types, really important. There is absolutely no aftercare. There is no, there's no ointments you have to put on. There's minimal redness. There's not, so it's like there's really 0 downtime. It's an extremely easy procedure that any one of your extenders can do. Like, as I know, Renato and myself have our estheticians doing this treatment. It's effective. 1 to 2 treatments. Most of my patients, even, a lot of my, for example, facelift patients come back at a year or 2, and they're loving their results, and they're like, what can we do non-surgically to just keep these results going? And come in once a year for a Sofwave treatment on your neck and just to keep it going, right? We all know that you can't stop aging. We can do a surgical procedure to move you back, but if they come in every year, to keep that treatment going and to keep the results, the patients will continue to be happy. And as we know, it's proven, FDA cleared, and very, very safe. So with that, I'm going to throw it over to my friend and plastic surgery colleague, Dr. Saltz, and let him talk about his experience.
Great. Thank you. Thank you so much for the presentation. Welcome, everyone. This is really exciting technology. I just got back from AMWC in Miami this past weekend, and we had a workshop with two excellent, outstanding dermatologists. And it's exactly what Jason was saying, that we're all very excited about this technology because one, is not going to affect much the faces and the facelifts we're going to be doing some of these patients, right, Jason? And like we see a lot of patients now with threads and burns and scar tissue. This is a technology that it affects very superficially, like Dr. Bloom presented. And he and I are surgeons, and we delegate this to our staff. In my case, I have 5 amazing licensed master estheticians, 3 in Park City, 2 in the Salt Lake office. And I learn a lot from them because I go to meetings, I learn about new technology. I always ask basically 3 questions. Is this safe? Is this will generate results? Will my patients be happy? And will be getting results as we promise to the patients? And 3, am I going to make money on this? And Sofwave was one of these very easy to adopt because it does answer those 3 questions. And that's one of the reasons I'm here. I don't often participate at webinars. I limit myself to a very few devices that I see great results, safety for our patients, and it's good for the business. So I think we're dealing with a very unique technology here. Dr. Bloom covered the most important aspects of the science. I'm going to focus a little bit on the business of Sofwave, and share with you what happened to in our practice in Park City and Salt Lake. We have 2 medical spas. I see patients in both locations. I operate in both in Salt Lake and Park City, and I want devices that were not going to cause any harm. And again, the master estheticians in my 2 practices are senior master estheticians, have a lot of experience. They don't mess with stuff that we don't get results and not safe devices. So in August last year was mid 2023 that, after many conversations with Louis Scafuri, the CEO, John Nippler, and part of the Sofwave team, that we decided to adopt the technology with understanding that tightened skin with ultrasound on face, eyes, neck, and chest. Later, we learn more about other applications. And for example, the arm application is terrific because I do a lot of brachoplasties. I see a lot of patients that can benefit from that application. So we don't have many patients with arm treatments, but it's certainly something that we are very excited about it. The cost varies from location to location. We don't really limit it once a year. We have patients that come every 6 months, and they had the treatment done in late July, early August, and they are now coming back for a second treatment. The revenue has been quite impressive. Now, this is gross revenue, but the margins, a 60% gross margin with a good, safe device that you see results, that's a no-brainer, at least in my business strategy for my 2 clinics. And recently, and I know we're going to talk about this during the Q&A, and I'm curious to listen to Jason, who has almost 4 years of experience with this device. But when we added Zimmer, which was actually a suggestion from the Sofwave team, when we added the Zimmer, many patients don't even get the numbing cream anymore. And I think what I hear is Zimmer and Pronox, Zimmer without Pronox, to make this procedure much safer. We did have, in the past, we did have a high intensity focused ultrasound as a demo in the practice, and was turned down by the aestheticians. They tried in some patients, was extremely painful, despite all the options that we had to minimize the pain, and we never got involved with that. And again, each one of you know your patients, you know your practice, but pain, discomfort is not something that I can sell well in Park City and Salt Lake City. So we had them train. Here you see the staff from having training with their local rep. We have done a lot of specials, a lot of social media appearance in our before and afters, like Dr. Bloom demonstrated, have been quite impressive. You know, I do a lot of facial rejuvenation surgery like Dr. Bloom. I do a lot of endoscopic brow lifts, endoscopic mid-face, and to think that one treatment will get this kind of a result without general anesthesia, without going through the whole operating room and recovery issues, it's really amazing that we have a device that can generate. This is one of our patients, one of Michelle's patients, master esthetician in Park City. So, you know, it gets me really excited. Now, a quick slide, because I think is important, as we discussed before we started the webinar, I think it's important to compare Superb with all the existing technologies. And as Dr. Bloom mentioned, this one stays in that superficial area, and it doesn't go down. It doesn't create a lot of scar tissue. It doesn't create problems, especially for facial surgeons like the two of us. So I think you're looking at a very unique technology, and you should pay attention to it, because the results, the type of injury that Superb causes is non-ablative and stays very superficially, and you get the results. So I think, to me, that is really unique. And at least in my hands, I haven't seen another device that patients can tolerate the treatment and generates results, safe results, and the economics are quite significant. A good comparison, because we did have this in the office for several weeks. We treated several patients, including some of the family members, the master estheticians, the office managers, and I think Superb beats all those issues. The coagulation pattern is different. The high volume coverage along skin tension vectors, you get 2 passes cover 28%. With 3 passes, you cover 43%. And again, no need for real-time ultrasound visualization. In staying superficial and in such a broad area without going down into deep dermis, affecting SMAS, affecting the subcutaneous tissue. I think that's very important, especially for surgeons like us. And we're going to have more discussion about those things. What I want to bring your attention to is to Pure Impact. I first learned about Pure Impact during my recent ABAM, the ski meeting we have here in Park City every February. And Lou and John brought this very unique device and their newest product. And I want to share with you during this webinar, because it's really cool. I think the industry has been waiting for something like Pure Impact, and we tried other modalities and without much success. And it will have an impact in my clientele. You know, Park City is terrific in the winter with the skiing, but it's also terrific in the summer. And people are very outdoorish here. They want to look good. They want to look fit. And this device will bring this to at least my clientele. So what is it? It's a wireless device that has is an electrical muscle stimulation device, and it can be used not just for certain areas, but you can actually distribute for many areas. It can be used while you exercise. It can be used in the office for strengthening, toning, and firming of abdominal muscles, buttocks, and thighs. This is, I even asked the Kim Bella before we started, do we have a new patient? This is actually the only patient we have with photographies and follow-ups, and was just shared with us in Park City a couple of weeks ago. You can see the device. Let me see if I can show you. I don't know if you can see. You can see the device here. It's actually really cool. It's very modern. And these are the principles of operation. It generates electrical stimulation to contract muscles rhythmically. And it's different than anything else we had before. And we had several in the office. And again, it generates, you can read it, so I'm not going to read with you, but the way it strengthens and firms and toning the muscles is completely different from what we had before. And you see here is applied to the abdomen in many different locations. You have the ability to target specific muscles. You have the ability to treat 2 to 4 areas in parallel. You have the ability to work on oblique and longitudinal muscles, the same treatment and at the same time. There's minimal discomfort, the intensity adjustment according to the subject, how the patients tolerate, high safety profile, and no downtime. And it can be done at the same time you exercise, which I think is really, really, really cool. And I was told during the advisory board we had in Park City that Pure Impact is the only muscle stimulation device that can stimulate the muscles, synchronize and emulates this polymetric exercise at the same time, which none of the other devices in the industry can do. So I think it's very exciting. I hope you stimulate some discussion. I don't have it. I told Lou, just leave me this one here in Park City and we're going to start using, but that was their only device. So I think it will be available in March. Correct me if I'm wrong, Carolyn. But it's something unique, it's something new, and I think we should really pay attention to what they're offering.
Okay, we do have a couple of questions tonight for you. And the first one is, do you ever have patients that do not see a visible result? And if so, are before and after photographs the key?
Yeah, I mean, again, with any kind of like non-surgical device, you can't tell people that, this is going to, I'm it's just all about, as everyone kind of has understood it, this is all about tempering expectations. Renato and I are surgeons, we do facelifts. So it's like, that's 100%, something like Sofwave is, you have to explain them that this is, being no downtime, being this is, one treatment, maybe 2. It's just all about explaining expectations. Now, one of the things that we have done recently is, because there's no kind of like open wounds after this or ointments and things, we like to do a lot of treatments at the same time. So for example, like my esthetician will do a Sofwave and an IPL. You can do that at the same time. It doesn't hurt anything. Or we'll do a low-level laser and a Sofwave to target different kinds of things. And when you kind of like, when there's a combining of a bunch of different technologies, the patient usually sees something from one different, whether it's a Sofwave or they see improvement. And again, we do take before and afters on every one of the patients for this kind of thing, and show them. But, again, in 4 years, if I had a patient that was really unhappy, and didn't see anything, you know what I would do? I would give them an extra treatment. You know, it's like I would comp them a treatment. Hey, listen, then I've never had a patient where I've done a comp treatment who came back and still said they were unhappy. You know, they know that you're doing everything you can for them to make them happy. So, I mean, that's kind of like how I deal with that. I would say the amount of unhappy patients with this is extremely low in my practice.
Our goals, Carolyn, like Dr. Bloom mentioned, you know, we're surgeons, so we know the neck lift, the facelift will be our great result. But I address all the consultations, all facial consultations, all facial aging consultations with a treatment plan, and I learned that from Terry Ross. And I have the treatment plan in front of me, and in the non-surgicals and the surgery, it's all combined. So even if they try to schedule something in the next 3, 4, 5 months, they will meet one of our master estheticians. We're going to start with something. In many patients, and I'm sure Dr. Bloom agrees, many of our patients are not ready for the facelift. And they come in a consultation and say, look, I want to schedule something for 2025. And my daughter's wedding is next year. So those are perfect patients to get them with some kind of treatments. Now, we have a variety of devices, a variety of non-surgical devices, and Sofwave is perfect for that sort of treatment plan. And I'll discuss with them. I'll bring a master esthetician to during my consultation, and I think it's very important for the colleagues that are listening to us. You know, have your treatment plan. Include that as part of your what I call facial aesthetic package, because many patients are not ready for surgery. Many don't need surgery, and you have something to offer. You get them ready for the procedure. You get them with your team, and you sort of control their expectations. Don't ever overpromise and underdeliver. Actually, the opposite. And when they're ready for surgery, you know, they already benefit from your non-surgical devices in your med spa practice.
Yeah, I mean, one other thing that I will say is that in February 2020, when I was looking at devices, something that I wanted was I wanted a skin tightening device that was no downtime, that produced results, and was easy to use, that I could delegate. Now, there are multiple different options out there, whether it's radio frequency or ultrasound, you know, that fall in that category. The hard thing is a lot of them are very, very, very technique dependent or user dependent. And, you know, there's like, oh, I get great results with this device, or I get great results with this device. And there are people out there who are really good at using certain devices. The nice thing about Sofwave is anyone can get good, you know, you don't have to visualize the smash. You're not like visualizing the layer, or, you know, it's very, very easy and safe for your staff to use. And so anyone can get good, you know, good results with this device safely, and you don't need it's so not you know technique dependent. You know, it's like universally people can get good results with this, versus some of the other devices are very, you know, it just takes a lot of ramp up for your staff to get good at using the device. And so this is a lot quicker learning curve, at least for my staff, in treating patients.
Yeah. Someone asked what makes this device different than other non-surgical devices you have in your practice. And I think you just answered that, you know, you can delegate it. It's easy to operate and all those things, no downtime and so forth. What about the woman who's like 40, 50, or 60? Maybe she's on the verge of needing a facelift. How many treatments would you use on her for the neck?
Someone in their 50s and 60s, I think they are perfect for facial rejuvenation surgery. You're talking to a surgeon that does a lot of facelifts. Uh,
Yeah.
so I'm gonna push that. If that there is an indication for that, I'm gonna push for that. But then occasionally, like I said before, oh, I'm not ready for this. I would like to start with something non-surgical. I think Sofwave is gonna be right at the top of the list, and we'll probably do one treatment, see what kind of results we get, discuss with the master esthetician because they really operate the devices. I don't pretend that I know how to
Yeah.
to set the numbers in the device, but in most likely she'll be a candidate within 6 months for another treatment. Again, a
Yeah.
lot depends on patient expectations, and that's you have to manage that. And frankly, Carolyn, sometimes for me it's very difficult because I know what I can do with that neck in the operating room. But 22 years ago, we opened 2 med spas, and I had to learn to be patient. I had to learn to understand the benefits of non-surgicals when combined with surgery. So that's what I love. What Jason just said. It's managing their expectations and understanding what the benefits of Sofwave offers.
And I know you do a lot of, both of you do the facelifts and stuff, but maybe someone had a facelift 5, 10 years ago, and now it's time for a little tweak. Would Sofwave be the recommended choice?
Yeah, I mean, if
100%.
they don't have like significant laxity and like if surgeries always are, I can say like we're going to go in there and do a surgery to improve this. I can't tell the Sofwave device to tighten her 25%, tighten her 30%. It's a we that we tighten them 100% when we're doing surgery. These are the patients who either don't want surgery, want any kind of improvement short, without a surgical thing, or they're like, you're talking about the 40, the early 40s to mid 40-year-olds, sometimes even late 40s, where they're just like on the, and I'm faced with this a lot because I used to say that most of my surgical candidates were mid 50s to mid 60s, and I think for face neck lifts now the majority, probably 75% of my patients, are in their early 50s. And our techniques are better, they're lasting longer, patients want to enjoy it for longer, but it's my age group. I just, I'm 45, and it's the 45 to just like that late 40-year-olds who want something, but I don't know if they're necessarily ready for a, face neck lift surgery. This is a procedure where I tell them you're going to get some improvement. And then I like how Renato says, maybe you do a treatment and we evaluate it. We see how it went. Are you happy with this? Do you want to kind of like maybe repeat this every 6 months or a year? Or are you ready to do something a little bit more? But let them, I don't want to rush that patient to surgery necessarily. Let them kind of, and this is a non-surgical device where I'm not worried about scarring in the SMAS. I'm not worried about, because this is not going that deep. This is only dermal, coagulation. So it's not reaching the areas that can, you're not burning any bridges for a later facelift.
Yeah. And this is an interesting question, and it kind of relates to what you just said. They ask, as plastic surgeons, do you see any change in the tissue quality after Sofwave at the time of surgery? They've heard of docs who do not like to cut into tissue after HIFU. Well, Sofwave is different. Tell us how.
Different, totally different. We just said you're not going, HIFU goes, there's a 1.5, but you can go 3 and 4 millimeters. That is into the subcutaneous tissue, into the SMAS. Like interestingly, I just did a face neck lift on a 52-year-old today. And it was, and again, I have not had a lot of issues with like kind of subcutaneous scar tissue or SMAS scarring, but I will say today it was a lot more difficult. And I think she has had a number of non-surgical treatments in the past. And today was just a little bit different than I've experienced in the past. So maybe it was just like an outlier, but I don't have to worry about that, like I said, with Sofwave, because it's not going to the layers. We're not cutting through the dermis. We're not dissecting at the dermal level. We're going at the SMAS layer, at the subcutaneous tissue layer.
Okay.
I think Carolyn, surgeons will welcome, and I'm so glad you invited both of us to present, because usually our dermatology colleagues talking, I think facial surgeons are going to welcome this device exactly for the reasons Dr. Bloom presented. I have many patients, Jason, that the neck dissection was a nightmare. You can't differentiate the planes. You try to slide your Mayo scissors, nothing moves, nothing, and you work on cement. I think if I haven't operated a patient that had Sofwave yet, so I can't tell you my surgical experience with it, but it makes sense. The technology, if it's limited to the dermis, I know I'm not going to be dealing with issues like we had with other devices.
Right. We have time for just a couple of more, and I want to throw this one out there. Given the depth of Sofwave is uniformly 1.5 millimeters, is it safe to work on the forehead since the skin of the forehead is so thin? And will it affect the fat layer?
I think I'll start on this, Jason. I do all my forehead work and my temporal work is endoscopic. And you work in a much deeper plane, much safer plane, and you're visualizing everything. And I've been doing this for almost 30 years now. I think it'll be very safe to work in that plane. It's in my experience, it's in a subperiosteal plane in the forehead. In the temporal areas, will be in a, right next to the deep temporal fascia. We go down into the mid face, always in a pre-periosteal plane. So we're fairly deep, and I don't see how this technology would impact or compromise that kind of dissection. But that's my experience.
Yeah, 1.5, you're still hitting skin. You're not going deeper than that. And the one difference that I've noticed with as I kind of like mentioned earlier, is the one difference I've noticed between Sofwave in the face neck submental area versus the forehead is it is anytime you're like over the bone directly, it does hurt a little bit more. So that's the one area where I just take honestly a little tiny 0.3 ml Botox needle, and I numb up supratrochlear, supraorbital on each side, totally numbs the whole forehead. It takes me less than a minute to do, or one of my nurses will do it for the estheticians, and it makes that treatment so much more comfortable.
Okay. And someone's asking, can you use this in conjunction with tretinoin?
Sure.
Yeah.
I mean, we like I said, same day we do IPL, we do kind of like, non-ablative fractionated lasers, we do Sofwave, we've done peels, things like that. All of this stuff on the same time. You're not affecting the epidermis, which is where tretinoin works, which is where IPL works, which is where those kind of like lasers and things are in epidermis or superficial dermis. They're two different layers, and you're not damaging the epidermis, which allows you to do and kind of like stack these treatments.
Okay. And then last question for tonight. It's almost 9. To what degree of tightening do you think you're seeing on the face and neck, in your opinion? Is it 10%, 20, 50? Or does it depend on how many treatments they've had and how lax they were in the beginning?
I can tell you what I tell my after. Go ahead.
Okay, go ahead.
Well, I tell my patients, surgery is 100%. Kind of like maybe like a subdermal RF probe, something like that, maybe 30 to 40%.
Yeah.
And I say about 15 to 20% with something like this. And I think reliably, I'll get a 15 to 20% improvement. And again, it's all about expectations. I do think that it probably does that, but I also am really honest with patients, and I explain, and some people are like, oh, this is going to be like 20 or 20% improvement. Like, I'm into that. That sounds good. And then I explain to them that, maybe we're going to get a 20 to 25% improvement, but 75 to 80% of your problem is still going to be there. It's like a marketing kind of thing and how you phrase it. So even if I'm doing the best non-surgical treatment where I'm giving you 40% in tightening, 60% of your issue is still going to be there. And so I explain that to them, that you're still going to see the issues that you have. It's just going to be better. And so that's kind of how I phrase it to them.
And it depends on their lifestyle and how much time they have and what their goal is. So, yeah. Dr. Saltz, do you have any comments to that question?
Not specifically to that question, because I think that's so subjective, and we can show you amazing results in the same day, same treatment, have not such a great result. But I think is the discussion with the patient, the understanding their needs, and how do you incorporate them into your practice, in the devices that you have. I love the concept of patients for life. I've been using that in all my talks, in all my articles, because that patient, I want to keep that patient with, and now I'm purely business. Forget the Dr. Saltz. This is a business decision you have to make when you buy these devices. I don't want that patient to fly and see Jason. I want that patient to stay right here with me in Utah. So
I want to go. I want to fly and see you and go skiing in Utah.
So if there's a new device, like I said, that is safe, that offers, great results, that's not going to compromise future surgery, and is hot in the industry, and my colleagues in dermatology, facial plastics, they like it, there's good science behind it, I want to have it, because patients are very educated. They're going to go anywhere, and you want to keep them in the practice, because eventually he or she's going to have that facelift. So I want to make sure I offer good treatments until they book the surgery. And that's pretty much how our philosophy here in Salt Lake City and Park City.
Thank you, everyone, again, and have a great night. We appreciate you being here.